Hello everyone, I am Dr. Sandeep Sharma, your pediatric faculty, and I welcome you to the pediatric discussion videos. Wherever possible, I have used the latest references because along with subject like PSM, pediatrics is another subject in which the updates are very relevant, not only for your vivas in university exams, but also for your competitive exams like NEET PG, INICT and FMGE. And in this chapter number 1, that is growth, I have used two references, the latest OPGI 10th edition and Nelson 22nd edition. In addition, we'll be doing conceptual discussion, but whatever is the past MCQ, I will be putting a small Q on top of it so that while revision, you know that this is a past MCQ point. And I'll be elaborating on a few things, and conceptual discussion, of course, will be there. So this video will be your one-stop solution for the chapter, that is growth. So let us start with the discussion. First of all, what is growth and what is development? Often in normal parlance, you would find that people are saying growth, people are saying development in same go. They say growth and development. But you need to understand that they are not the same. Growth refers to increase in size or mass of tissue. So when size increases, that is growth. What is development? When functions mature, that is called as development, right? So growth stops after a certain age. Development continues lifelong. Your physical growth has stopped, right? Most of you, all of you in fact. And development is maturation of functions. So right now you are learning from me. This is what? This is a kind of development. But in a young child, particularly first 12 or 13 years, growth and development continue simultaneously, and so the term growth and development is used. So what is growth? Growth refers to increase in the size or mass of tissues. So when there is increase in size or mass of tissues, we call it as growth. What is development? Development refers to maturation of functions. With this in mind, we come to the first topic in the chapter, that is periods of growth. Now, these definitions you need to remember for the competitive exam. These definitions can be asked directly, they can be asked indirectly. Directly, they can ask you adolescent period, what is the cutoff? This is the old NEET PG question. Indirectly, how they can ask you? There was a question some years back, what is the most common cause of pneumonia in a school-going child? So school-going child age group, you first need to know, and then you should know the causes of pneumonia age-wise, and you apply both the two concepts together and you get the answer to the question, right? So MCQ solving is an art, but understanding theory and remembering it in a way that it is relevant for your exams is the most important thing, right? So simultaneously in these videos, we'll also be discussing the ways you are supposed to understand and you are supposed to apply, because whatever topic you read, number one, you should understand the meaning. Number two, you should know what are the ways it can be asked. So periods of growth, it can be asked directly, it can be asked indirectly. So what is the ovum period? According to pediatric definitions, ovum period is period from 0 to 2 weeks. What is 0? 0 is the point of conception. When the child is conceived, when the embryo is conceived, when the ovum is fertilized, from that point of time till about 2 weeks, the product of conception is called as ovum. Okay. What is the embryo period? Embryo period extends from 3 to 8 weeks. So first 2 weeks, the fertilized ovum, the product of conception is called as simply as ovum. What is embryo period? It is the period extending from 3 to 8 weeks. And then what is the fetal period? It extends from 9 weeks till birth. Then we have the perinatal period, and perinatal period definition is a past MCQ point, so I'm putting a Q on top of it. Perinatal period extends from in utero life and continues postnatally as well. So it extends from 22 weeks of gestation. So 22 weeks of gestation and continues till 7 days of postnatal life. It continues 7 days of postnatal life. This is the definition according to WHO and used in pediatrics related to perinatal period. Now, what is the newborn period? Newborn period refers to the first 4 weeks of life. First 4 weeks of life after birth. So, first 28 days of life after birth, the child is called as neonate. Neonate and newborn are the same thing. Who is an infant? Infant is the period which is in the first year of life. First year of life. So, remember the funda. All neonates are infants, but all infants are not neonates, right? So first 28 days is the newborn period. The entire first year, including the newborn period, is called as the infancy period. Then we have toddler, which is the period between 1 to 3 years. Then we have preschool age child, which extends between 3 to 6 years. 3 to 6 years. Some of the books write it like this. They write it like, instead of 3 to 6 years, they write it as 37 months. 37 months till 72 months of life. 6 multiplied by 12 is 72. So this is also, it is sometimes written. These are the games examiners can play. Instead of writing 3 to 6 years, he or she can write 37 months to 72 months. That will also mean the same thing. I've just given an example how these things can be asked and create confusion in your mind. So school age child is between 6 to 12 years. School age child is between 6 to 12 years. So basically, school age period will be starting from 73rd month. So up to 72 completed months, it is preschool age child. Now, school age child is 6 to 12 year. Whenever I teach this, there is always a student asking me, sir, but I went to school at 4 year. What is you went to school does not matter. Definition is a definition, and school age definition is given by UNICEF and WHO, and they say any child between 6 to 12 year should be called as a school age child. And then we have the adolescent period. As I told you, it is an old NEET PG question, so I am putting a Q on top of it. Adolescent period is between 10 to 19 years. Between 10 to 19 years. Adolescent period can be subdivided into 3 parts. There can be early adolescent period, there can be mid-adolescent period, and there can be late adolescent period. Early period is between 10 to 13 years, mid is 14 to 16 years, and late adolescent period is 17 to 19 years. This breakdown of adolescent period can also be asked in the exam. So these are the definitions that you need to know. Moving further, let us talk about some MCQ pearls and one-liners. One-liners are relevant, and end of the day you need concepts, you need application of concepts in MCQs, and you need to remember the facts as well. That is a balance that you need for your exams, and that will be needed in every subject that you will be preparing for. So here we will be talking about some one-liners. So first is human growth pattern. What is the 2 characteristics of human growth pattern? The 2 characteristics which have been described, they are called as cephalocaudal and distal to proximal. Cephalocaudal and distal to proximal. What is the meaning of this? See, every organism has a certain way of growing. In case of humans, it is cephalocaudal and distal to proximal. What is the meaning? Now, the entire human body you can divide into 2 parts. One is the central axis, which is starting from the head region, right, from the crown of head and ending in the anus part. And second are the forelimbs, right? These are the 2 broad categories of the human body you can define. So the central axis always grows intrauterine life and postnatally also cephalocaudal. What is the meaning? First of all, in utero there will be a head growth, then there will be trunk growth happening. So cephalocaudal means the upper part grows faster compared to lower part. You can correlate it by thinking of a newborn. When a newborn is born, the head is bigger, the remaining part of the body is relatively smaller. And this type of pattern is called as cephalocaudal. Okay. Second is limbs. When you talk about the limbs, it is reverse. Distal part grows first compared to the proximal part. What it means is the fingers and palm elongate first, followed by forearm, followed by arm. So this type of pattern is called as cephalocaudal and distal to proximal. So you can get an MCQ in the exam, which of the following is true regarding human growth pattern. So you have to remember, you have to identify and mark that statement which says cephalocaudal and distal to proximal. Second point, factors affecting fetal growth. Now, fetal growth depends upon multiple factors. This topic has been asked. I am putting 3 Qs here. 3 Qs does not mean 3 times. It has in fact been asked 5 to 6 times. 3 Qs here mean it has been asked in FMG entrance, it has been asked in NEET PG entrance exam, and it has been asked in INICET entrance exam. So every competitive exam this has been asked. So what are the factors affecting fetal growth? First of all, fetal growth depends upon fetal hormones. So what are the fetal hormones which are relevant? There are 3 important fetal hormones you need to remember. The 3 important fetal hormones are, first of all, insulin. Insulin is considered to be the most important hormone for fetal growth. How much will be the eventual fetal weight will depend upon insulin level. Second important hormone after this is thyroxine. Thyroxine is thyroid hormone, this is involved in metabolism of the fetus. So which hormone is involved in metabolism of the fetus? It will be thyroxine. And third, by controlling metabolism, obviously it will control the fetal growth. And third will be corticosteroids. For example, cortisol and similar other corticosteroids. So steroid hormones. Corticosteroids are involved in maturation and growth. They are involved in maturation and growth of lungs, that is pulmonary system, as well as liver and GIT. So what are the one-liners examiner can ask you? Which is the overall most important hormone for fetal growth? Insulin. Which is the hormone important for fetal growth? Controlling metabolism? Thyroxine. Which hormone plays a role in fetal lung maturation and growth? The answer will be corticosteroid. Remember that if it is a preterm child and if it is a preterm labor, which drug we give to the mother to make the fetal lungs mature? You have read about it in Obs-Gynae and we'll be discussing in subsequent chapters also. It is dexamethasone. And this is the rationale that corticosteroids are responsible for maturation and growth of lungs, liver and GIT. Okay. Now, secondly, it is dependent upon growth factors. There are growth factors which are produced in the fetus as well as from the placenta. And these growth factors are IGF-1 and IGF-2. IGF stands for insulin-like growth factor 1, insulin-like growth factor 2. They are both also called as somatomedins. They are also called as somatomedins. Somatomedins are also involved in producing fetal growth. And third, it is dependent upon maternal factors. What are the maternal factors? Maternal health and nutrition plays a very important role in affecting fetal growth. If the maternal health is not good, suppose mother is having teratogen exposure, mother is having anemia, the fetal growth will be affected and fetus will develop IUGR. Similarly, if the mother's nutrition is good, the fetal growth will be good and the birth weight of the child will be good, right? So, fetal hormone, growth factor and maternal factor. And there comes your INI-CET MCQ. Which hormone plays least important role in a fetus? It is growth hormone. Growth hormone becomes important postnatally after birth, not before birth. So this is a small one-liner based topic, but I have tried to discuss in a conceptual way so that whatever way question is asked in the exam, you are ready for it. And if you read Nelson and Opigai, you would find we have covered almost everything that you need for the exam, right? So this is factors affecting fetal growth. Then another one-liner, fetal thyroxine secretion begins at what age? It's a one-liner thing. Fact to remember, 12 weeks of gestation. And finally, lean body mass correlates with which factor? What is lean body mass? If you remove, in my body, if you remove all the water, all the fat, what will be left? You will have protein and skeletal tissue which will be left. That muscle and skeletal mass together is called as lean body mass. We already know that if there is lean body mass which is good, the adult is very active and he has a good weight, he has a good cardiovascular health. But studies have now shown that better lean body mass in a child is also related to the height of the child in adulthood. So lean body mass closely correlates with stature, that is height of the child. Stature, height of the child. What it means is that better lean body mass in the first decade of life, that is first 10 years, is responsible for better height in adulthood. See, height depends upon multiple factors. Height depends upon nutrition of the child. Height depends upon the parental height, the genes you have inherited. Height also depends upon the physical activity. Good physical activity means better bone growth, better muscle growth, better lean body mass, and better lean body mass will translate into better adult height. And that is why physical activity is so important, right? So these 2 points are related to one-liners you are supposed to remember. And then we come to extra edge topic. This extra edge topic is briefly mentioned in both Ghai and Nelson, and it is very relevant to the topic that we are discussing. What is Barker's hypothesis? Barker's hypothesis basically says that fetal problems are responsible for adult problems, right? So it is also called as fetal origin of adult disease, FOAD. It is also called as developmental origin of health and disease, that is DOHAD. These are the alternative names. What does Barker hypothesis say? Look at the photograph. Now, if there is a pregnant lady, this is a pregnant lady and this is the fetus. If this pregnant lady is given adequate nutrition, the fetus grows adequately. When the fetus is born and it is a baby, the baby will be healthy, and this healthy baby will turn into a healthy adult. So no diseases will be there. On the other hand, if there is maternal malnutrition in pregnancy, the fetus will not grow, and so there will be IUGR. You can compare the two pictures. This is a small fetus, this is IUGR, which has happened. If there is IUGR, intrauterine growth retardation, the child, when he will be born, he will be having a low birth weight. And this low birth weight child, what will do is, whenever there will be fetal disease and fetus will be low birth weight, fetus will be IUGR, and when he is born, there are changes which happen in the physiology of fetus or newborn. These changes make sure that the body tends to develop a conservation kind of physiology. What it means is the metabolism will slow down. And so these patients, when they become adults, these fetuses, these children, when they become adult, they will have higher chances of developing diseases like obesity. They will have higher chances of developing diseases like type 1 diabetes mellitus as well as type 2 diabetes mellitus. And they will have higher chances of developing cardiovascular diseases. And this is related to the disease, the malnutrition produced in utero and first few weeks of life. This is called as Barker hypothesis. Stress, less weight, malnutrition in fetus and in early newborn period leads to irreversible changes in the metabolism of that organism, and so when they become adult, they manifest in the form of obesity, diabetes and cardiovascular diseases. This is called as Barker hypothesis. How to remember for the future exam? You can remember like this, that fetal undernutrition leads to low birth weight when the child is born, which leads to irreversible changes in the metabolism of that person. And these patients, when they become adult, in adulthood, they have increased chances of lifestyle illnesses. I hope you know that obesity, diabetes and cardiovascular disease, stroke, metabolic syndrome, they are all called as lifestyle illnesses. This is what you call as Barker hypothesis, right? Add it to the notes and remember it, understand it. Barker hypothesis is a potential ticking time bomb waiting to be asked in your entrance exam. And it is there, it is mentioned in most of your textbooks also. We just don't read them in the proper way. Now, moving further, we come to the next topic, that is growth curves. Growth curve again is a very, very high yielding topic, and I am putting again 3 Qs here. 3 Qs does not mean 3 times. It has been asked actually more than 3 times. All the 3 competitive exams, NEET PG, INI CET and foreign medical graduate exam, it has been asked. Now, what are growth curves? Growth curves are also called as Scammon's curves. They were given by a person known as Scammon, so they are also known as Scammon's curves. Scammon did research and he made 4 types of growth curves. On each growth curve, on the x-axis there is age, on the y-axis there is percentage which is mentioned. And he said that 4 tissues grow in a very unique manner in every healthy child. If there is a deviation from that growth pattern, it indicates disease in the child. This is the mechanism, this is the meaning of these growth curves. So these growth curves are showing how a normal tissue grows in a normal child. Now, what examiner can ask you in the exam is, they can show you the photograph and ask you to identify the tissue. Or reverse question, they can give the tissue and give 4 options with 4 diagrams as I have shown here. And they will ask you to identify which growth curve is corresponding to that tissue. And third, INI CET way. On one side, 4 tissues, on other side, 4 type of graphs, and they will ask you to match the column. So let us identify first of all. Look at the first growth curve. Now this growth, rapid growth is happening in the first 2 years. It is reaching almost 100% in 3 to 4 years and then remains the same throughout life. Which tissues grows rapidly in the first few years and then remains the same throughout life? Remember, this is brain tissue. So which tissue is being talked about? This is brain tissue growth curve. Okay, look at the second growth curve. Rapid growth happening till about 3 to 4 years. Between 4 to 10 years or till about 12 years, growth is happening, but it is gradual. And once puberty comes around 10 to 12 year, growth again picks up. Which kind of tissue grows rapidly in first 4 year? Then there is a gradual growth. Only when puberty comes, again there will be an uptake in the growth. This is skeletal tissue. And skeletal tissue is responsible for our height. So skeletal or somatic tissue or physical growth is depicted by this type of graph. So which tissue is being shown? Skeletal or somatic or physical growth. And what is the shape? This type of shape is called as sigmoid shape. This type of shape is called as sigmoid shape, also called as S-shaped growth curve. So examiner can ask you one-liner. In a Viva you can be asked, S-shaped growth curve is shown by which tissue in the body? Your answer will be skeletal tissue, right? Third growth curve. Have a look at the third growth curve. Now this was 100%, this was 100%, and the tissue has become hyperplastic between 4 to 8 years. Which tissue in the body becomes hyperplastic between 4 to 8 years and then reduces and becomes normal static? Remember, it is lymphoid tissue. Lymphoid tissue, which is found in tonsils and in lymph nodes, becomes hyperplastic. It increases in size after birth, becomes hyperplastic between 4 to 8 years. This is the time you will have recurrent lymphadenopathies with every viral infection, recurrent tonsillitis happening because the tissues are hyperplastic. So any insult will cause them to enlarge, and then they reduce and become normal. So this type of shade, partial bell-like shape, if you see which tissue is being shown in growth curve? Lymphoid tissue. And last growth curve is very easy to understand. Almost negligible growth was happening till about 10 to 12 year. At 10 to 12 year, puberty started and there was a rapid gain in a few months. Gonads grow like this. So gonadal growth is shown in the fourth picture, right? The reason I have said these words is, any of these words, any of these statements which I have told you in the last 5 minutes could be a way examiner will ask you in the exam. So you have to identify, and if you have understood like this, there is no way you can go wrong in the exam. So 4 types of growth curves, remember for your exams. Let's move further and talk about the growth patterns. How does the growth happen actually? So these normal growth patterns we need to know. This is a chapter, this is a video where we are talking about the normal things, right? So growth pattern, first of all, weight gain. How does the weight gain happen in a child? Let us first talk about first year of life. Now, suppose whatever is the first year of life, in the first 3 months, what happens in the first 3 months of life is every normal child, normal I'm writing like this, every normal child loses 10% of the weight in first week of life, that is first 7 days. What it means is, suppose there is a child born with a weight of 3 kg, so 10% of that will be 300 gram, right? So every child, normal child, in the first 7 days will not gain weight. He or she will lose weight. How much? Up to 10%. It can be 5% for a few, it can be 7% for a few, it can be 10.1%. But generally, average about 10% weight is lost in the first 7 days. Why it is lost? Because a fetus has a lot of edema fluid. And when the child is born, when the child passes urine, the weight gain is less, but the loss of weight due to that mobilization of the edema postnatally, that exceeds, and so there is a relatively weight loss which is happening, and that is considered to be normal. Only when the weight loss is not happening, or if there is a very excessive weight loss, then you should be concerned, right? So every normal child loses 10% weight in the first 7 days. Then between 7 to 10 days of life, between 7 to 10 days of life after birth, the birth weight is regained. Birth weight gets regained. So 3 kg child will again become 3 kg between 7 to 10 days, right? And beyond 10th day of life, now true weight gain will start. There will be visible weight gain. And what is the visible weight gain beyond 10th day? Till about 3 months, it will be 20 to 40 grams per day. 20 to 40 grams per day. And this point I'm writing in red, putting a Q because it's a old NEET PG one-liner question. Beyond first 7 to 10 days of life, what is the daily weight gain till 3 months? This is what the question was. The answer is 20 to 40 grams per day. Okay. And between 3 to 12 months, we are talking about the first year of life, na? There will be average weight gain of 400 grams per month. Weight gain will occur. 400 grams per month weight gain will occur in a normal child. This is what we are talking about, a normal child, right? So these are facts that you need to remember. Now, ready reckoners. Ready reckoners means you are using the birth weight value to predict the weight at a certain age. This method is called as ready reckoner. So, in a normal child, suppose birth weight of the child is X. Suppose birth weight of the child is X. It could be anything, 2.53, 3.5. At 5 months, the weight becomes 2X. I'm putting a Q here. Old MCQ one-liner. Doubling of birth weight happens normally at what age? Answer will be 5 months. At 1 year, the weight becomes 3X. So, tripling of birth weight happens at what age? In a normal child, 1 year of age. 2 years, the weight becomes 4X. 3 years, the weight becomes 5X. 5 years, the weight becomes 6X. 7 years, the weight becomes 7X. And 10 years, the weight becomes 10X. And this is for normal child. For normal child. This has its limitation that if there is a weight in between these ages, you cannot actually identify. But in a OPD setting, mother comes to you and she says, my child is not growing well, his weight is not less. We ask the birth weight of the child, and based upon that, quickly we can understand whether the child's weight is within normal limit or it is abnormally high or abnormally low, right? So ready reckoners are used in this way. So they can ask as one-liner in a normal child. Normally, birth weight doubles at what age? 5 months. Triples at what age? 1 year. And so on. Questions can be asked. They can ask indirect question. Weight of a child is 3 kg at birth. Now the child is 10 years of age. If the child has grown normally, what should be the average expected weight? So at 10 years, it is becoming 10 times the birth weight. Your answer will be 10 multiplied by 3. That is 30 kg. Right? This is ready reckoners. And something which you will need for your MCQs. Sometimes the same thing can be asked as a mathematical question. Look at the question. What is the percentage gain in weight at the end of first year of life? Option A, 50%, 100%, 200%, 300%. Now, this is a very, very tricky thing, and this is an important thing. You need to be careful when you are solving questions like this. I'm not doubting your mathematical skills, but it is always safe if you write in the proper way. So the question is asking you, what is the percentage gain of weight after 1 year has ended? So what was the formula we discussed? Birth weight was X. At 1 year, what is the weight happening? It was 3X in a normal child. So what is the gain? Gain is not 3X. Gain is 3X minus X. That is 2X. And so what will be the gain percentage? Gain percentage will be gain divided by original value, what the child was born with, multiplied by 100. They get cancelled, and so the gain percentage will be 200%, and that is your answer. So answer is not D, the answer is C. This is an actual MCQ which was asked some years back, and many students mistakenly, in a rushed way, they marked the answer as 300%, thinking ki 3x ho raha hai, so it will be 300%. No, the gain percentage will be 200%. And that is why solving previous year questions and solving Q-Bank questions is so important. Along with these videos, the Q-Bank that you have at DocTutorials, the questions will be aligning with those. So do practice those questions, but of course, after reading the theory. So MCQ example, this is the answer. Answer is 200%. Let's go further. Now we'll be needing the help of Week's formula. Week was a person who gave some formulas, and he said, these are the formulas to calculate ideal weight. These formulas will be useful in your clinical postings also. And there is a problem with these. The benefit is, ready reckoner only tells you about 1 year, 2 year, 3 year, 5 year, and so on. Suppose there is a 3.5-year-old kid, you cannot know the weight via ready reckoner. So for those ages, Week's formulas can be applied, right? The disadvantage of Week's formula is they tell you a expected weight for a American kid. These were given by Western people, and so if you apply them in Indian kids, then sometimes they overestimate the ideal weight. Having said that, we don't have a better formula, so we remember them. They are more useful for practical purpose. You can get numerical question in the exam. So what are the formulas? So if there is a child who comes to you and you have to calculate expected weight between 3 to 12 months, how will you calculate? In a normal child, the formula is age in months plus 9 divided by 2. That will give you the expected weight between age 3 to 12 months. If the examiner asks you expected weight between age 1 to 6 years, the formula is age in years multiplied by 2 plus 8. Don't miss the brackets. Brackets are important. Remember body mass. And expected weight between age 7 to 12 years, the formula will be age in years multiplied by 7 minus 5 divided by 2. When you're reading for the first time, these formulas may appear a bit tricky, but eventually it is not that difficult and they will be useful in your practical life. Tomorrow, they will be useful in your real life as well. So if you say, sir, I am not going to become a pediatrician, it's okay, but you'll have kids tomorrow, right? And you won't be going to a pediatrician on a daily basis. At least you can see whether your kid is growing normally or not. And end of the day, even if you are say a cardiac surgeon or obstetrician or a pathologist, people will still be, you are still an MBBS, people will still be asking you and asking about the advice of their kid. My kid is not growing well. These formulas will tell you whether something actually needs to be done or not. They will give you a clue. Growth is normal or not, weight gain is normal or not. If it is abnormal, then only you will go for the malnutrition indices, which is a separate chapter. So these formulas are important for your practice, for your life, and for your competitive exams. So these are the Week's formula for ideal weight in a normal child, right? Let's go further and talk about length. So we have talked about weight gain pattern. Now we'll talk about the height gain pattern. Now, what is length? What is height? Very simple rule. Less than 2 years of age, we use the term length. More than 2 years of age and above, more 2 and above, we use the word height. The height and standing height are synonymously used. So for age up to 2 years, the preferred term is length, and 2 years onwards, the preferred term is height. Length is measured by which device? This is the device which is used to measure it. This device is called as infantometer. And this device is called as stadiometer. So infantometer is used to calculate length, and height is checked in a child by stadiometer, right? So they can ask you to identify the device which is being used. Then there are ready reckoners related to this as well. In a normal child, in every normal child, the length at birth is average 50 centimeter. At 1 year, if the child is growing normally, it will become 75 centimeter. At 2 years, it becomes 87.5 to 90 centimeters. And at 4 years, it becomes 100 centimeter. And this is a very, very important MCQ point. I'm putting a Q on top of it. See, doubling of birth weight happens at 5 months, but doubling of birth length happens at what age? It happens at 4 years of age, right? And what is the expected height in centimeter between age of 2 to 12 years? Suppose you get a 5-year child, 6-year-old child. So there is a Week's formula here also, but single Week's formula, thankfully. So the formula says, if there is a child between 2 to 12 years, expected ideal height can be calculated by the formula age in years multiplied by 6 plus 77. You can get numerical on this. Suppose they ask you a question. 5-year-old child comes to you, what should be the ideal height of the child? So 5 multiplied by 6, 30 plus 77, 107 centimeter. Whatever is the closest option to that, that will be the answer. Okay. Now, we have some height velocity patterns you need to know. And on these height velocity patterns, MCQs are asked. These are fact-based questions. So first of all, gain. What is the height velocity? Height velocity means rate of gaining height per year. So gain in the first year. How much height the child gains in first year? You would be surprised to know maximum height gain happens in the first year of life. And this is a standalone MCQ by itself. So I've already written it. So maximum gain post-birth happens in which year? First year of life. And what is the gain? See, length at birth was 50. Length at 1 year is 75. So gain per year is 25 centimeter per year. 25 centimeter per year. In bracket, you can write that first 6 months of life, the gain is 16 centimeter. And between 6 to 12 months, the gain is 9 centimeter. This is something which is written in OP Gai textbook also and a separate page Nelson also. So you need to remember it like this. Between 1 to 2 years, what will be the gain? The gain will now become 12 to 12.5 centimeter per year. 12.5 centimeter per year. 2 to 5 years, the gain will now become about 6 to 7 centimeter per year. Between 5 to 12 years, the gain will be 5 to 6 centimeter per year. Before 2020, INICET was called as AIMS entrance exam, and there it was a one-liner question asked. They had asked as a one-liner, what will be the per year gain? They had not given a range. One of the option was 6 centimeter per year, and that was the best answer among the options given. And then when the puberty comes, we know that pubertal growth spurt happens. So pubertal period, there will be variable increase in the height velocity. When we say variable increase in height velocity, you will remember that peak height velocity, also called as peak growth spurt, in case of males will be 10.5 centimeter per year. And peak, this is the maximum which will happen, that is called as peak. And peak height velocity in case of females will be 9 centimeter per year. And that is why males tend to have a greater height in general compared to females. So, maximum gain is happening during which period? You can easily identify, you can easily see it is happening in 25 centimeter per year period. And that is your answer. You can remember it, you can add it to the notes. Now we have talked about weight, we have talked about length and height. Now we come to the third thing, head circumference and chest circumference. Head circumference is written as HC. It is also called as occipitofrontal circumference or OFC. This is the other name. Head circumference is measured at the level of head. The measuring tape passes through the frontal eminence and through the occipital protuberance, and that is why we call it as occipitofrontal circumference. And chest circumference in a child is measured at the level of nipples, and there is a correlation between them that we need to understand. So what is the normal OFC at birth? In a term child, in a normal, healthy, average term child, it is between 33 to 35 centimeters. It is a normal Indian child. These values may vary for a child of a different race, different ethnicity. So normal OFC at birth, average in a term child in India, it is 33 to 35 centimeter. And then the high yielding topic, gain of OFC per year. In the INICET May 24, they had asked question related to how much OFC or how much head circumference a child gains in 1 year. Just now we had discussed height velocity. Now they are asking OFC velocity, that is head circumference velocity. So how to remember it? You will remember like this, that between 1 to 3 months of life, the child grows 2 centimeter per month. And this is what was asked in the entrance exam. Between the age group of 4 to 6 months of life, the child grows about 1 centimeter per month. Then 7 to 12 months, the child gains how much head circumference? Only 0.5 centimeter per month. Then between 1 to 3 years, the child gains 1 centimeter every 6 months. 1 centimeter every 6 months. So it slows down even more. And between 3 to 5 years, it becomes 1 centimeter per year. These values are given in OPGHAE. They are given in your clinical manuals, and already question has been asked in INICET May 24 exam. So similar question can be repeated, same question can be asked, or some other age question can be asked in your competitive exam. So you need to remember it, useful for your vivas, useful for your theory, useful for your MCQs. Now, then next thing, at birth, every normal child, have you seen a normal newborn? If you have seen, you would know that head in a newborn is bigger compared to chest. But in you and me, the chest is bigger compared to head. So, at birth, the head circumference will exceed chest circumference in a normal newborn. And how much will be the gap between them? The gap will be 3 centimeter. So, at birth, every normal child, head circumference exceeds chest circumference by 3 centimeter. They become equal at what age? Head circumference becomes equal to chest circumference at around 9 months of age. If they ask you a range, it is between 9 to 12 months. And beyond what age? Normal child, chest circumference now becomes greater than head circumference. It will be beyond 12 months. That is beyond 1 year of age. So beyond 12 months, the head circumference will now be shorter compared to chest circumference, right? Now, there are two scenarios which can be asked on this, two clinical scenarios we are discussing. First case scenario, examiner can ask you, a child was born and you noticed that the head is bigger than chest, which is fine. But the gap is not 3 centimeter. The gap is more than 4 centimeter. If the head is too big, there are two possibilities. You should suspect either the child is having increased head circumference due to hydrocephalus. And second possibility, the child is having a type of IUGR called as asymmetrical IUGR. More on the types of IUGR we have discussed in the video on neonatology, so we can see it there, right? So there are two possibilities, hydrocephalus or asymmetrical IUGR. So asymmetrical IUGR basically is a condition where the head grows normally and the chest is shrunken. Because the brain is paired, so head grows normally, so there is a large gap between the sizes of head circumference and chest circumference, right? One of the two will be mentioned in the question and that will be your answer. Second scenario, examiner can make a case. 15-month child, 18-month child, 2-year-old child above 1 year comes to you and you find you were expecting that chest should be bigger than head, but still head is bigger than chest. So what should be suspected? Two possibilities. Either the head is abnormally big or the chest is abnormally small. Now IUGR will not persist till this age. So there will be two possibilities. Either it is hydrocephalus or it is hydrocephalus or it is severe malnutrition. Have you heard of a thing called as marasmus? So these marasmic children, due to severe wasting, you will find that these patients are having chest circumference very shrunken, and so head will still be bigger compared to chest circumference. So these are the two scenarios which can be asked in your entrance exam. And last way, MCQ can be asked. I told you head circumference exceeds chest circumference by how much value? 3 centimeter at birth. What question can be asked in the exam? If I'm an examiner, I can make a very simple question to check your concept. I will say, a child was born, normally, term child, head circumference was found to be 34 centimeter. If it is a normal child, what should be the chest circumference? So if it is a normal child and head is 34 minus 3, it will be 31 centimeter. So basically they are checking your concept of gap between head and chest circumference. In a normal term baby, it is 3 centimeter, right? These are the ways MCQs can be asked. When you practice, you will find all these varieties. But in the discussion itself, I am covering concepts and as many MCQs as possible so that your strike rate picks up. See, you don't understand the thing and your MCQs are going fine. That is not correct, right? Because change in language will be troublesome. And you have understood the concepts very well, but you are unable to solve MCQs. Again, my job is half done. So we are trying to strike a balance. You should strike a balance. I am striking a balance in whatever I am teaching here, right? So these are the scenarios. And then finally, we come to some one-liners and last portion, last 5 minutes of the discussion. One-liners to remember from older MCQs. So 65 to 70% of adult head size is attained by what age? It is attained at birth. So when a child is born, the head circumference is about 65 to 70% of the adult. And 85 to 90% of adult head size is attained at what age? It is attained at 2 years of age. OP Ghai says 90% attained at 2 years. Nelson 22nd edition says 85% attained at 2 years. So we are taking we are basically humoring both Ghai also and Nelson also, because we don't know what examiner who's making your questions is going to use for reference. So 85 to 90% head size attained by 2 years of age. Then finally we come to upper segment to lower segment ratios in a normal child. These are all normal we have discussed in this video. So what is upper segment? From crown of head to midpoint of pubic symphysis is upper. From midpoint of pubic symphysis to sole of foot is the lower segment. You and me, the lower is bigger and the upper segment is smaller. But when a child is born, upper is bigger and lower is smaller. So what are the ratios? At birth, in a normal child, the upper segment is bigger than lower segment by a ratio of 1.7:1 to 1.9:1. At 3 years, this ratio becomes 1.3:1. 6 to 7 years, the lower segment again more catches up. Now it becomes 1.1:1. And 8 to 10 years, the ratio 1:1 is attained. Many of the books, many of the clinical manuals wrongly mention that 7 year 1:1 is attained. No, at 7 years it is not attained. Clearly mentioned in your most standard references like Ghai and Nelson, and also other references like IEB textbook. of Pediatrics and Piyush Gupta's Clinical Pediatrics. All of these textbooks, if you read them, they all agree and they say that in Indian children, the ratio of 1:1 comes by 10 years of age. So if you have two options in the exam, 6 year, 7 year, 8 year, 10 year, which is the option you will mark? 1:1, the answer will be 10 years of age. This is according to Ghai. You can see the textbooks. And beyond 10 years of age, the adult ratios will be attained. What is the adult ratio in you and me? The adult ratio in you and me is 0.9:1. So our lower segment is slightly longer compared to the upper segment. And also remember the funda that upper segment is also known as sitting height in the child. So these are the normal things. Only when you know normal and your concepts are clear, you will be able to appreciate the abnormal things better. I hope you benefit from it. Let's go to the next video after this video. Thank you so much.